The quality of our egg and sperm cells is incredibly important to our ability to get and stay pregnant. This is true for those who are trying naturally to conceive and anyone doing IVF or egg freezing. Today, I'm so happy to bring you this episode with Dr. Kalea Wattles, a naturopathic doctor and certified functional medicine practitioner, where we talk all about how our mitochondria, those little powerhouses of the cells, impact our fertility and reproductive longevity. Let's get into it. All right, Dr. Kalea, thank you so much for being with me today.
Such a pleasure to chat with you. I always love connecting with you.
Yeah, always so much fun. So before we jump into our topic today, I would love to hear more about you or have our listener learn more about you. What got you into fertility and particularly the functional approach to fertility?
I think, as most of us find, our journey to functional medicine or to anything that we specialize in is through our personal experience. So for me, I was in naturopathic school, and halfway through my program, I got pregnant with my first baby. And it was such a magical and transformation experience. But what it taught me is, even as someone with multiple health degrees, I didn't know how to prepare for pregnancy. I knew nothing, and it was scary. And I had to go do all of this digging for myself, which luckily I had the resources and the tools to do that. But through that process of learning about ovulation and how to best prepare your body and then getting pregnant and becoming a mom, I really experienced such a magical transformation. And I realized how desperately I wanted that for anyone else who wanted to be a parent. So I really devoted the rest of my clinical training towards pregnancy, preconception, postpartum care. And part of that story was essentially cold calling the fertility clinics in my area and saying, listen, I know I'm not a traditional OB student or resident, but please let me come be with you and spend some time and see what you do and learn more about how the work that I can do in naturopathic functional lifestyle medicine could impact your outcomes. And I was so fortunate that three different clinics accepted me. So I was able to spend time with my local reproductive endocrinologists in the IVF setting, doing IUIs, doing intakes, doing egg retrievals. And I learned how all the things that I do could support fertility, whether someone was trying on their own or they were preparing for IUI or IVF. So it was a really powerful experience. And I was living down the street from the Institute for Functional Medicine headquarters at the time. And so again, I was like, my cold call technique has worked so far. So I cold called them too and said, I'm in my last year of my clinical training. Can I intern? And they were like, we don't have an internship, but you're right down the road. We'll figure something out. So I was able to get into the Institute for Functional Medicine, learn the functional medicine model, which was such a beautiful blend of the reproductive endocrinology and the naturopathic medicine I had been learning. So now I have this whole system that's the functional medicine framework with naturopathic therapeutics and really geared towards collaboration with reproductive endocrinology. And it just worked out great.
That's amazing. Yeah, that's so
Yeah.
special to have that insight too into like oftentimes when we aren't in a field, we don't have any insight into what they do unless we've gone through it ourselves. Say, for example, someone who has had fertility concerns and had to go to the IVF clinic. That's the only way we'd really learn. So it's amazing that you were able to be in there learning and really integrating what you were learning in naturopathic school at the same time. That's so cool.
That's right. And it taught me, obviously, some people, patients will come and their goal is they want to get pregnant on their own and they don't want to necessarily move on to IUI or IVF, and that's completely valid. But it also gives me the insight to say, okay, if that feels best for you to move on to those interventions, which are there for a reason, I feel like I have the tools to set you up for success. So I think it gives everyone this added layer of perspective, which is really special.
Yeah, absolutely. And being able to have an informed conversation too with people can be so nice, where it's not just some scary thing, or it's not just the conventional approach. It can be a very integrated thing to best serve people.
And everyone wins. Everyone
Yes,
wins when we're all
everyone.
utilizing our
Yeah,
strengths.
gotta love that. Yeah. Awesome. Today we're talking about something that we as functional medicine doctors love to talk about is our
Yes,
mitochondria
love it.
and particularly how they affect egg quality and contribute to reproductive and longevity. And so I'd love to hear your take on that of just maybe let's start with maybe give a quick refresher of what mitochondria are for those people who don't know about it, and then we can jump
Yeah.
into why they're so important.
Maybe it's been a while since we took biology class
Exactly. Yeah.
and haven't talked about mitochondria for a while. So maybe can I start out by sharing a fun fact?
Yes, I would love that.
I always hope that this comes up in a trivia night, that someone will hear it and then they'll be at trivia night with their friends and this will come up.
Yeah.
Our egg cells, or our oocytes, have the highest concentration of mitochondrial DNA content in the human body. And I'm just going to give some perspective to my piece of trivia. A fully grown egg cell contains like 100,000 mitochondrial DNA copies. And to put that into perspective, if we compare that to other things that we would think, oh, that needs a lot of power, muscle or a neuron, those might have 2,000 to 20,000 mitochondrial DNA copies per cell. An egg cell has this huge number of mitochondria compared to other cells because they need a lot of energy. And that is directly related to the mitochondria's catchphrase, which they're the powerhouse of the cell. That's what everyone remembers.
Yes.
From a PR perspective, the mitochondria are nailing it in that it's the powerhouse of the cell. So, how I like to talk about that is what does that really mean? Mitochondria are these tiny structures that are found in most cells of our body, and they're responsible for generating cellular energy. So sometimes I'll talk about it like, oh, we can think about them like cellular batteries because they're going to convert energy from, say, the food that we're eating into a form that our cells can use. It's like an energetic currency. And that currency is paying for really energy intensive things like ovulation, fertilization, implantation, early embryo development. So they're really front and center in the fertility world, but in so many other areas of our body too, which is why we love them so much in functional medicine, because there are cellular energy superstars.
Yeah. And then how do those, how you alluded to it of why or that they are so important,
Yeah,
but then does the health of the mitochondria then impact the egg quality and how we're able to do all of those things to get pregnant and stay pregnant?
totally. This is a big deal. And I have three ways that I like to talk about this. So I'm hoping you'll help me keep track
Okay.
so that I don't get lost in my three ways. So, number one, like I said, all of these complex processes that an egg cell is going to go through require a lot of energy, which is created by that mitochondria. And it's interesting when we look now in IVF studies, for example, there's all of this evidence to show that the potential for an embryo to be successful is really related to the egg cell's ability to generate energy with their mitochondria. So that early developmental process, if you think about it, we're like growing a whole human from scratch. It's very energetically expensive and fragile. And so our mitochondria are really helping to power that process. The piece I'll lay on to that is because I love talking about fertility longevity or reproductive longevity. I'm pregnant with my third baby right now in a pregnancy that's considered advanced maternal age. I'm 37 and I love to think about how can we set ourselves up for success to enjoy robust fertility for however long we need it so that we can have this life that we dream of. And so there's an ovarian aging component here too when we think about mitochondrial energy production because just as we get older, inherently we have this age-related decline in our mitochondrial function. We have more mutations of our DNA, our mitochondrial DNA, and then just a decreased mitochondrial DNA copy number, so just less mitochondria to do the work that we need. So part of my goal is always to preserve that energy producing capacity of the mitochondria. So number one, they give us energetic currency. That's the first thing. Number two, this is cool. It's another little like adventure into reproductive anatomy and physiology. I have to bring up granulosa cells. They're my favorite little cells. I think they're so fun to talk about. Granulosa cells are, I don't know how you talk about them, but I call them like the helper cells or the nourishing cells for our egg cells. So they surround our eggs in our follicle, which is essentially our egg sac. And they receive hormonal messages from the brain and they help our egg cells be nourished. And part of how they do that is there's this bidirectional communication between our egg cell and these helper cells, our granulosa cells. And that bidirectional communication requires abundant and stable mitochondria to supply the appropriate amounts of energy so that communication can happen. So, how it looks in the real world, if we have mitochondrial dysfunction, that energy isn't there, so that communication can't happen. We might have more anovulatory cycles, so someone's not ovulating as regularly. And maybe it's someone who they've done IVF, or they went to freeze eggs and they found they didn't have very many eggs, or their eggs didn't respond to medication in a way that we would expect and they didn't mature. Or it might be someone who maybe they're in their 30s and they go in to do an evaluation with their fertility doc, and the doc tells them, you don't have very many eggs left. Your ovarian reserve is running out. So that's one area where I really like to support the mitochondria so that we can get that polite, respectful communication between the granulosa cells and the egg cells happening.
Mhm.
Okay, so that's 1 and 2. Are we ready for number 3?
Yep.
It's going to involve some storytelling on my end because it's all about DNA repair genes. And I love to talk about this. It's so fun. It's one of those things that I'm sure you think this all the time too. Like, humans are so complex. How do any of us turn out normal?
It's crazy. It's my,
How do any of
yeah.
us function? Because it's so complex. So the way this story goes is healthy egg cells. And when I say healthy, I mean they have adequate energy from their mitochondria and they have plenty of antioxidants, which we can talk about antioxidants later, but they play a big role. So healthy egg cells can utilize DNA repair genes that allow them to clean up DNA fragmentation from sperm. Like, what? This is so mind blowing to me. So, how the process works is that the sperm will travel to the egg, and the sperm head meets the zona pellucida of that egg cell. And that initiates this acrosome reaction that helps to facilitate the transfer of the sperm DNA into the egg cell. That's how we're combining our DNA so that we can make a baby. And then using the energy that was generated by our healthy and robust and beautiful mitochondria, that egg cell will then go to work cleaning up any damaged DNA from the sperm cell, which
Mm.
is fascinating to me. And it can do this as long as it has that energy available. So if we think of the poorer the mitochondrial health of this, I'm sorry, the poorer the mitochondrial health of that egg, or the more damaged DNA the sperm cell has, this process is just not going to work as effectively. So we have to think about, oh, what are the things that are damaging the eggs and the sperm? Things like smoking and hyperinsulinemia and oxidative stress from environmental exposures, all these different things are going to impact that process. But how amazing to think that when we take care and we're proactive, our egg cells can do all this fascinating work. So those are my top 3 reasons.
Love
In
it. Great.
summary, why our mitochondrial is so important for egg health and for our reproductive longevity.
Yeah. They're instrumental.
Instrumental indeed. And that's why this is one of my favorite topics. And I really think there's no conversation about fertility that's complete without thinking about mitochondrial function.
Absolutely. Yeah. And so then with that, how, I mean, you mentioned oxidative stress a little bit there. How does that influence I guess to go into a little bit more detail with oxidative stress, you mentioned some of the things that cause oxidative stress. How can someone maybe approach that with trying to help their mitochondria?
Yeah. So, one of the ways that we combat oxidative stress, of course, is with antioxidants. Oxidative stress, antioxidants. So, maybe I think oxidative stress is a familiar term to many, but I can give a little detail about just what that involves.
That would be great. I find a lot of people that I talk to are like, I've heard about it, but what exactly is it again? Like they're not totally clear on what it is.
Exactly. Oxidative stress is, it's essentially, I think about it as like compounds that can damage DNA. And we're all familiar with antioxidants. Like we want to eat the rainbow so that we get all of our antioxidants. Oxidative stress is on the other side of that equation. So, oxidative stress is really driving damage to our mitochondrial health. And so, when we have these pro-oxidants and in relation to our antioxidants, they're out of balance, that results in cellular damage. And I always like to say, it's easy for me as a functional medicine doc to villainize oxidative stress, to villainize inflammation, right? But
Mm.
actually, some oxidative stress in the body is totally normal and totally expected. Just because of our metabolism, the way that we produce cellular energy, it inherently creates some oxidative stress. But the problem is really when we get an excess of those pro-oxidants that surpasses our capacity to combat that oxidation with our antioxidants. So
Mhm.
that's when we see the damage really become an issue. And we can enter this vicious cycle where The oxidative stress is damaging our mitochondria. So now our egg cells are not working as well. And then because our mitochondria aren't working as effectively, we're not combating that oxidative stress. So we're just going round and round. And that's when it becomes really important for us to intervene and to break that cycle. So that's where I think about let's bring in some antioxidants so that we can tip that scale a little bit. That's where it makes sense to me. And I like to talk about antioxidants in kind of two different forms. We have our non-enzymatic antioxidants. These are things like the brightly colored fruits and vegetables, polyphenols, all of these when we eat the rainbow. And then there's our antioxidant enzymes that we can still support nutritionally. So these are enzymes that are going to help with our antioxidant capacity in our body. So I think about our non-enzymatic antioxidants are things like vitamins A, C, E, our polyphenols, and then things that we might want to get from supplements. So a lot of the antioxidants, I'm sure you feel the same. I'll try to get from food. That's where we're like, eat the brightest, most beautiful produce that you can. But sometimes it's really helpful to bring on some supplements, CoQ10, melatonin, alpha lipoic acid. We can talk about all of those. But then we also have these enzymatic antioxidants, which help to naturally protect us. They're enzymes that we make, but they rely on some trace elements like copper and selenium and manganese. So we really want to make sure that we're having that intake of all those beautiful antioxidants, but then also some minerals. It's usually for me a combination of food and supplementation, but there's still all these lifestyle factors to tap into, but antioxidants are usually such a go-to because we can get them through food
Mhm.
and they're going to have fiber and all of these other things that support all of our body systems.
Yeah, absolutely. So with that, and maybe we could go like you were going into already, the top
Yeah.
strategies to mitigate those effects. Maybe let's start with some of the nutritional things like you were talking about. You mentioned eating the rainbow, definitely very
Mhm.
important, getting nutrient sources like
Mhm.
fat soluble vitamins, those
Yep.
minerals. Anything else that you recommend to people when they're navigating this?
Yeah, I'll add a layer on that's nutritional, metabolic, and that brings in a lot of things we've talked about already. It's insulin resistance or hyperinsulinemia, which is elevated insulin. That's one of the most common sources of oxidative stress, at least in the female body. And so we see this often in the setting of PCOS, but even outside of PCOS, when there's just hyperinsulinemia, that really generates so much oxidative stress. And then we really have to work hard to combat that. So, keeping our blood sugar balanced by getting that adequate dietary protein. And I just had an opportunity to chat with a really brilliant protein metabolism researcher. His name's Dr. Donald Lehman. And we were just talking about all the most recent updates in protein metabolism. And he said what his main goal is for people these days is to get 35 grams of protein within an hour of waking. And I said, I've been telling patients for years, like 25 grams of protein with each meal. And he said, yes, that's great. But really, we're seeing the most metabolic impact is with that higher protein intake upon waking so that you're refilling your stores of essential amino acids. And then what you do for the rest of the day, like, of course, make good choices, but it's really that first meal of the day. So I'm shifting and evolving the way I'm thinking about metabolic health and insulin, and that's one of the goals that I'm really holding. But then of course, always important when we're having carbohydrates, mixing those carbohydrates with fat or fiber to keep our blood sugar in a range that's not having these wild escalations or peaks and valleys so that we can really prevent those big spikes of oxidative stress too. So in addition to all the foods, we got to think about just our metabolic health at large.
That's such a great reminder and something that I'm talking with people a lot about because I feel like there are so many people out there who are skipping breakfast for whatever reason. They're not hungry, they're not fueling themselves appropriately and having those spikes of blood sugar, that roller coaster can be such a detriment to so many different aspects of their health. So it's great to bring that back to this also that it's really important to have that stable blood sugar and prevent that insulin from getting too high.
From
Yeah.
a chronic inflammation standpoint, the oxidative stress standpoint. And I'll just add, I think a lot of my patients, they're aware of oxidative stress. Maybe they're concerned about it because of maybe irregular cycles or they've been trying to conceive for a while. Maybe they've been through IVF already and didn't get eggs to mature the way that they thought they would. Maybe information is so readily available. We're all like digging through the internet and reading all these things. And I find that patients will come in and they have spent a lot of money like doing mold testing and all of these really expensive tests, which there's absolutely a time and place for things like that. But then I'll do just a really standard blood work and I'll see, wow, there's actually raging insulin resistance happening here. And if we would have caught that 6 or 9 months ago, we could have intervened. And I think it would have saved you money, but also heartache and frustration and like spiraling about all of the possibilities. So I always just try to make this point that let's capture the low-hanging fruit and make sure that these foundations of metabolic health and chronic inflammation and nutrient sufficiency are there before we escalate to the things that are very valid, but just less likely.
Yeah. Yeah. I completely agree with you. And that's how I practice also. And yeah, it can get very expensive to go down the rabbit hole of all those things when there are some basics that could be game
Yeah.
changers for sure.
And confusing too. It's like people
Yeah.
tell me all the time, I am so overwhelmed with just everything that could be possibly wrong with me. And so
Mhm.
that's why we start with these foundational things, metabolic health, hormonal health, thyroid, inflammation, the things that are most common, we can check them off the list. And I think the insulin resistance and just ensuring like broad spectrum antioxidant coverage in our nutrition is
Mhm.
such an approachable place to start.
Yeah, absolutely. Yeah. And then from there, any lifestyle tips, since we're just jumping right into
Yeah.
treatment, we'll go back to identifying for someone who isn't sure if they need to do all this, but maybe some other lifestyle pieces. You had mentioned not smoking, maybe not excessive alcohol, things like that. What else
Mhm.
would you add on to that?
I mean, the lifestyle piece is so important, right? In functional medicine, we always start with those modifiable lifestyle factors,
Mhm.
sleep, stress, exercise, nutrition, relationships. So we've talked a little bit about the nutrition piece. The other factor that I love to talk about is sleep. So many of us, it's if something has to fall off the list, it's sleep.
Yeah.
I'll catch up on that later. I'll sleep when my work is done. But sleep is so important for our mitochondrial function. And we could have a whole episode dedicated to like circadian rhythm and circadian medicine. It's so cool, but our body really responds to our light and darkness cues. And in terms of oxidative stress and egg quality specifically, I've got to bring in my beloved melatonin to the conversation, right? Because we know that if we're in bed, I tell my patients, I want you in bed before 11 p.m. in complete darkness. And I want you to hold your hand in front of your face, and you shouldn't be able to see it. I'm talking dark. And that allows our body to make its own natural melatonin. And melatonin is one of the most powerful antioxidants that's in our follicular fluid, which is the soup that our egg cells are swimming in. And it's protecting our egg cells against oxidative stress. It's protecting a developing placenta against oxidative stress. So, sleep and the timing of sleep in particular is really powerful. So, I love if we can get like a 10 to 6 or an 11 to 7. That's my ideal timing in a
Mhm.
dark room. And it's when we look in animal studies, we see that sleep deprivation, and so typically that means less than 5 hours of continuous sleep per night, results in lower estrogen, lower FSH, so this disrupted communication between the brain and the ovaries, increased oxidative stress within the egg cell, decreases in mitochondrial DNA copy number, and a decrease in our mitochondrial membrane potential. So it's harder for our mitochondria to make that energy just because we weren't sleeping enough. So I know it seems basic, but that one's really important to me.
So important. Non-negotiable, in my opinion.
Negotiable.
Yeah.
And it's hard. And I know people are like, I'm going to bed at 12:30. And so then we have the conversation, okay, how can we start backing up your bedtime by a half hour,
Mhm.
letting you adjust? And then I'm a fan of doing what you got to do if you need some blue light blockers because you have to be on your phone or you have to answer emails in the evening after kids go to sleep. I get it. Bring in some blue light blockers then. And then I'm a fan of supplementing melatonin too. I use a pretty low dose, but I like that little boost of antioxidant protection in the night, especially for my patients who are over 35. There's some pretty cool studies coming out about melatonin in ovarian aging. And in fact, I wish I knew the title, but this cool paper came out recently and it said For those over 35, melatonin should be considered a first-line therapy for rescuing egg cells from reproductive aging. And I was
Wow.
like, wow, what language? I
Yeah,
love
that's
that.
powerful.
Really powerful. So we'll maximize our body's ability to make melatonin, but I'm not afraid of a little melatonin boost as well.
Yeah. Yeah.
And then exercise. Exercise helps us with what we call mitochondrial biogenesis. So helps us to create new mitochondria and also helps us to improve the energy production of existing mitochondria. For me, that means moderate intensity. So nothing too strenuous is needed. There's maybe other reasons why you might want to do higher intensity training, but from a mitochondrial perspective, moderate exercise. So 150 minutes per week is the general recommendation. And that means like you're breathing, but you could hold a conversation. For my Peloton friends, I'm like, that's a zone two. A
Yeah.
zone two is what you need for your mitochondria. And I think that's really helpful. And again, we have some animal studies showing that exercise has been shown to improve our egg quality because it helps to maintain the normal mitochondrial distribution in our egg cells. So I always tell people, whatever exercise you like to do, let's do that. It doesn't have to be complicated.
Yeah. And that makes it so approachable to just say, okay, get it in, moderate activity, whatever it is. Yeah.
Yeah, exactly. And then a layer that I like to add, it's easy for me to say in Seattle because our weather is not warm here
Mhm.
most of the time. But people always ask me about cold exposure for
Mhm.
their mitochondria. And we know that cold exposure is good for our mitochondria. And I've asked, we have many mitochondrial experts in our functional medicine world, and I've talked to many people about this. And it seems like the effect, it doesn't have to necessarily be like a cold plunge or cryotherapy. It's really somewhere below 55-ish degrees. And for me, I'm like in Seattle, that's every day.
Mhm.
I could go outside at any moment and get that. So maybe you do a little walk after your biggest meal of the day to support your insulin sensitivity for the next 16 hours. It's 50 degrees outside. You're like really checking off the list of your mitochondrial support.
I love that. Yeah. And that's so great. I feel like I love that you brought that up because the biohacking stuff sometimes then we skip over the basics. Oh, I'm skipping sleep, but I'm doing this crazy cold plunge or high intensity exercise. And what you're saying is it doesn't have to be crazy to be super powerful and effective. Just get outside, don't bring a jacket, get
Yep.
moving.
Get
Pretty
your body
doable and
moving.
approachable.
I saw this meme. I saw an internet meme one time that I really thought was so good. It said something to the effect of if you are getting up at 5 a.m. to exercise after only 4 hours of sleep, you are stepping over dollars to get to pennies.
Mhm.
Wow. When you say it like that,
Yeah.
I so agree.
Yeah, I agree too. Have had to have some tough love with some patients about that. Please just skip the workout and stay in bed if it has not been that much sleep. It's gonna be so
Yeah,
much more important. Yeah.
exactly. And then once we kind of have these foundations covered, like we're sleeping well, we're moving our body, we're eating our antioxidant rich diet, then I think, okay, now it's appropriate to talk about what are some of these other fancier things that we want to do. And I think red light therapy is all the rage right now.
Mhm.
And
Yeah.
we're
I
seeing
love
more and
that.
more red light therapy is so good for our mitochondria. So I'm a fan, but you will never catch me saying, yeah, do your red light therapy, but we don't care about insulin or we don't care about the nutrition. It's always a both and for me. And it comes after we've established those healthy foundational lifestyle factors.
Great.
But then get under that red light for sure.
Yeah, yeah. And when you talk about that, I love your take on this because I get the question all the time of like location of red light and near infrared versus red light. Have you
Yeah.
seen anything in particular about those, like answering those for people?
Okay, so it's really interesting when you look in the studies, especially in the IVF setting, the red light is applied to the neck. And it seems really counterintuitive, but they're doing a lot of mitochondrial support at the neck, and there's a systemic effect. Now, I work with a lot of the acupuncturists in my community, and they're doing red light therapy over the ovaries and
Mhm.
having a ton of success. So for me, the verdict is still out. I'm not sure yet. It seems like there's a variety of benefits in terms of location, but it's interesting to watch the different wavelengths. It seems like 680 what is it, nanometers is like the best wavelength for fertility right now. I keep my eye on it because there's always something new coming out. But at this point, I'm not sure.
Yeah. It sounds like no matter what, it can be helpful as an addition. Maybe it doesn't matter so much.
Yeah, we even see there's all the red light therapy for the face, and you wear the
Mhm.
face mask. And then people will start doing that for their skin, and they're like, wow, all of a sudden my knee pain is better, or my
Mhm.
low back pain, or my sciatica. So there's definitely something to it. I'm staying tuned.
Yeah, yeah. And then since we're on the topic, how about level laser therapy?
Yeah.
You have an opinion on that?
Yeah, there's quite a few, again, acupuncturists in my area who are doing it. And this is anecdotal at this point. I don't have any hard evidence, but I've seen improved ovulation rates. I've seen in my couples that are going through IUI or IVF, maybe we weren't maturing follicles as quickly as we expected. We bring in the low level laser therapy and we're getting bigger, juicier follicles quicker.
Mhm.
So I'm a fan.
Yeah, awesome. And then you mentioned some supplements earlier. Maybe we go
Yeah.
into that now, like what your top supplements are,
Yeah.
maybe in addition to melatonin.
Maybe I'll give it like a top three. We'll just see. We'll just see what emerges. But melatonin is definitely one of my faves. And people always want to ask me, like, oh, is there some timing? Should I do it all throughout the cycle?
Mhm.
I do. I do it all throughout the cycle. But when we look to the research, which is again usually in an IVF setting, it seems like really just a couple weeks out of the cycle. So in a lot of studies, they're doing like after the heaviest bleeding days are over until mid-cycle. So maybe cycle days 4 through 10 or 12, giving doses that are typically between 2 and 5 milligrams. They're seeing melatonin concentrations in the follicular fluid are increasing by 4 times the level, and their improved fertilization rates, improved clinical pregnancy rates, improved live birth outcomes. So I'm a fan. I'm doing it all throughout the cycle, but I think even a couple weeks during the cycle is really helpful for melatonin. So that's a fave. Let's see, my other, maybe even more than melatonin, it's hard to pick a favorite. I love CoQ10. It's one of my most important fertility supplements, again, especially in those who are older than 35. But we know that CoQ10 is just a really powerful antioxidant to combat that oxidative stress that can accumulate in our cells, especially as we get older. Some really cool research came out in 2024 that were looking at women. They were over the age of 35, going through IVF. They took the treatment group, gave them CoQ10 for 60 days before their embryo transfer, and they had significantly less canceled transfers, significantly improved embryonic development. So I think this is so amazing and powerful for anyone who's trying on their own. They're doing IUI, they're preparing for IVF. Love CoQ10. I'm doing research, the most recent research that I've seen is really suggesting that we're using a dose of 300 to 600 milligrams daily for men or women. So that's what I'm doing. I'll usually start at the lower dose and work my way up because most of the products have medium chain triglycerides, which can give some people loose stool, which they're not loving me for when it first happens. So we're ramping our way up. So melatonin, CoQ10, and then glutathione. Glutathione can shield our egg cells from damage that's caused by oxidative stress during what's folliculogenesis, which is just the maturation of that follicle. Like I said, this happens. It's inherently part of the process, and it's fine as long as we have the antioxidants to balance out that oxidative stress. So glutathione just directly. I love a glutathione, or I'm doing N-acetylcysteine, which is a glutathione precursor. An added benefit there because it also helps with cervical mucus, getting that egg white consistency, which we love. And then I really have my eye, I'm experimenting. I haven't used this for as long as the other ones, but everybody's talking about NAD right now or NAD
Mhm.
precursors. So I'm experimenting with our NAD precursors because again, some really cool animal research came out showing that NAD can, again, this language, rescue our egg cells from aging because of the way that they support some of our antioxidant enzymes. So really exciting. I'm experimenting with that. And then the last thing I'm going to call out is DHEA
Mm.
because this is something I measure in every preconception patient. I measure DHEA sulfate, and then I will tailor a supplemental dose based on those results. But DHEA is such a powerful energy support for our egg cells. And this seems unjust to me, but as we get older, even like 25, our DHEA starts to plummet, which seems really unfair. And then we have this less efficient energy production in our egg cells. So I like to supplement DHEA as well in someone who needs it and then monitor just to make sure that their dose is appropriate to maintain their levels.
Yeah. I love that you brought that one up too, because that's one of my favorites also. What range of DHEAS do you like to see, and where could someone maybe benefit from it then if they're lower than that?
Yeah, I like to see it, depending on what your reference range is, in the upper quartile of the reference range. I always forget the units, but at Quest and LabCorp, it's 200, what is it, micrograms per deciliter? 200 at Quest
Yeah.
or
Yeah.
LabCorp,
Yeah.
the upper 25% of that reference range. And so I'll supplement to get there, and then I check it every 6-ish weeks or so just to make sure we stay there because DHEA is interesting. If it's too low, it impacts ovulation. If it's too high, it impacts ovulation. So we have to keep it in the sweet spot. Where do you aim?
Same. Yeah. And I know as you're saying that, I was like, oh, I don't remember the reference
Units.
or the units either. But yeah, same, like around 200 or so. Yeah, depending on the person and their goals too. Even if it's just like in perimenopause and we're trying to get hormonal support going, then same in that same
Yeah.
range.
And it can really, I tell people like, yeah, we're doing this for your egg cells, but also you may experience the added benefit of a little more energy, maintenance of your lean muscle mass, improved libido, improved
Mhm.
cognition, especially in someone who comes in and their DHEA sulfate is like 35. They're
Mhm.
gonna feel so good when we add a little bit of DHEA.
Yeah, it can be a game changer. Yeah.
Yeah.
Sure. Awesome. Again, to take it a step back now, we've jumped right into therapies.
This is so
But to take a step
exciting.
back for the person who's listening and who is, okay, so maybe the person over 35 should probably implement a lot of these things, but someone who doesn't know, maybe, do they need to be concerned about this or not? What would you
Yeah.
be your approach? Are there any things that they can watch out for to start?
Mhm. So it's interesting when we look at just cellular energy production at large, taking fertility specifically out of the picture, there are some conditions that we see more often when there's mitochondrial dysfunction. And in functional medicine, the way that you and I were trained is to look for patterns, this pattern recognition piece of what kind of patient persona are you looking for so that you should call upon some mitochondrial support. So that could look like migraines, fatigue, chronic pain, anxiety and depression, just brain fog or feeling like, oh, I'm not as sharp as I once was. If you have a family history of neurodegenerative diseases, so Alzheimer's, Parkinson's, those are all building the case for getting on some mitochondrial support. And then if we look more into the fertility world, I'm thinking about people who maybe in a previous pregnancy had preeclampsia or pregnancy induced hypertension. Oftentimes, we need to do some mito support there. PCOS, certainly. Like we've talked about, anyone that has irregular ovulation, just because we know mitochondria are so important for that follicular development, low ovarian reserve, these terrible terms like premature ovarian insufficiency. We
Mhm.
want to think about mito support. And then anyone who has a history of recurrent pregnancy loss, I really want to make sure they have the mitochondrial support. And then if we bring in our partner has a semen analysis, if there's any issues with motility, so motility is it describes the way that our sperms swim in a roughly forward fashion. And if we look at a sperm, so we have the sperm head and then there's the sperm tail, and in the mid piece of the tail is where the mitochondria are. There's 50 to 70 mitochondria. Remember, by the way, that egg cells have at least 100,000 and
Mhm.
the sperm have 50 or 75, but that's what's giving the sperm the energy to swim forward. So if we look at the motility and these guys are not swimming, we need some mitochondrial support. So there's probably, I know that seems like a big list, but it's things that pain and movement, all of that really requires a lot of energy.
Yeah. So giving those things can give us a clue and doesn't necessarily mean that you have to have all of those things to have a
Right.
problem, but they could be an indicator that there's something that's not quite right for their mitochondria.
Yeah, and then I'll make the case, like I said, just as we get older, we have less CoQ10, we have less DHEA, we
Mhm.
have longer exposure to oxidative stress. So this term, it's one of my favorites, inflammaging. It's
Mhm.
like the way that inflammation and oxidative stress drive aging in our body. It's really the length of exposure that is driving our level of inflammation. And just as we get older, we've just been exposed to the world more pollutants and more blood glucose. And so just thinking about how we support ourselves as we get older in a really gentle and lovely transition into our older years.
Yeah, I love that. Yeah, I hate the conversation is always around age as a number. It's always, oh, you're over this age and that's the problem. And it's yes, but it's really not just the number. Like you said, it's those years being exposed to oxidative stress, but also that can be going a lot faster or a lot slower depending on how you're taking care of yourself, what you're exposed to. So yeah, I feel like that's so important to be having that piece and that part of the conversation, not just, oh, you're old and so now it's not going to be good. It'll be terrible now.
May I add a personal anecdote to that note? When I was 35, so a couple years ago, I decided I'm gonna do a biological age test.
Mhm.
They're becoming more and more available, and I was curious working in the functional medicine space. So I'm 35. I was working really busy corporate job. I had two little kids. I was hustling, like stress level all time high. I did my test, and as a 35-year-old, my biological age came back 42 and a half. And here I am, like a functional medicine doctor, doing all these things, and I'm devastated.
Mhm.
So I took some time, had a career change, like really focused on taking care of my nervous system, which again, that could be a whole other episode of how dysfunction in our nervous system and our vagal tone impacts oxidative stress and inflammation. But I really went all in on supporting my nervous system, taking care of myself, really focusing on those lifestyle things like sleep that I was taking for granted. And I'm 37, did the test again after doing all these things, and my biological age came back only 32.
Love
So
that.
I like de-aged by a decade, not by really doing anything too dramatic, really focusing on those lifestyle things and just making sure that I was taking care of my mental health. And it really made such a big difference.
That's amazing. I so appreciate you sharing that because it can be so extra
Oh my
devastating
gosh.
as a functional medicine practitioner to see that. But that's such a great point that you really can turn the clock back 10 plus years with just getting back to the basics and really supporting yourself in a more well-rounded way.
Yeah. We always want to say our chronological age is a measure of time, but our biological age is a measure of function.
Mhm.
And that part, we can rewrite that story, and it's really empowering. And when we talk about like all these things that impact our epigenetics, which is all the things we've talked about today, the lifestyle factors, the nutrition, that is how we erase parts of our story and rewrite them in a way that's more health promoting. And so I think we talk about lifespan all the time. Like, oh, our lifespan, but our chronological age, yeah, that's reflective of our lifespan, but our biological age is more associated with our health span. What percentage of those years are we well and feel good and doing the things we want to do? And I think there's some opportunity for like a fertile span in there too, of how do we extend those years where our reproductive health is thriving and it is possible.
Yeah, absolutely. That reproductive longevity, we can support that so women can have babies into their late 30s, 40s without a
Yes,
problem, healthy pregnancies, the babies are coming out thriving. Yeah.
absolutely.
Awesome. And on the last note, what kind of testing do you like to do in this space? Say maybe someone doesn't have those bigger signs, but they're really maybe concerned, they're struggling, or they're just wanting to be really proactive about supporting their egg quality. What can they test?
Yeah, so we can go to the standard lab, right? And there's a couple things that we can get. We've talked about insulin resistance already. So I love to get a fasting insulin, a fasting glucose. We can type our numbers into an insulin resistance, a HOMA IR calculator, and just get an idea of, okay, what's going on with our metabolic health. A lipid panel as well is a great way to get this information. We can do a triglyceride to HDL ratio, which talks to us about our risk for insulin resistance. So a couple things we can do just at the regular lab. Another one is iron. Iron excess is a big contributor to oxidative stress. I don't see it I'm interested to hear if you see this a lot. I don't see it as often as I see low iron, but it does come up in my fertility practice a
Mhm.
decent amount.
Same. I have a good handful of patients with iron overload. Yeah.
Yeah, it's very inflammatory. So just catching that. And so for me, that's a ferritin and iron, a total iron binding capacity, really a full iron assessment, really accessible and inexpensive and available at all these labs. I also like to measure uric acid. So this one I've maybe been doing for the last 2 years or so. I didn't start out doing this, but uric acid it's famous because it causes gout, which I think is why most people know what uric acid is. But it's also really important for fertility and pregnancy outcomes. And what we know is that uric acid at low levels is anti-inflammatory, and at higher levels it's more pro-inflammatory. Again, I can't remember the units on this, but I'm aiming for numbers that are 2.5 to 4.5.
Mhm.
Above 6 is where we see more risk for gout. And what we know is it can serve as somewhat of a predictor for things like preeclampsia or pregnancy-induced hypertension or intrauterine growth restriction. So if we know what it is before pregnancy, how empowering we can reduce that oxidative stress, reduce that inflammation, so powerful for health outcomes for both mom and baby. Another thing on my standard lab that's related is I'm looking at a high sensitivity C-reactive protein, HSCRP. It's my favorite inflammatory marker. Reflects our overall total burden of systemic inflammation. There's such a relationship between oxidative stress and inflammation that I'm often pairing these together. And so those are the things I'm getting just at the standard lab. If we want to take it up a notch, we can look at some markers of oxidative stress. So I think a lot of people in the fertility space, they've done a Dutch test or they've done a Nutraval. And so they're going to get a marker that's called 8-hydroxy 2 deoxyguanosine. Big fancy name. We call it 8-OHDG for short, but that reflects oxidative damage to our mitochondrial DNA specifically. So that can be really helpful. Some of the functional tests we have will also measure something that's called F2 isoprostanes, and that measures oxidative damage to our lipids, which is also indicative of mitochondrial oxidative stress. So that's a great one. And then we've talked so much about this balance between oxidative stress and antioxidants. We can measure our total antioxidant capacity so that we can understand, do we have the antioxidants to counterbalance all the oxidative stress that seems somewhat inevitable in
Mhm.
life? We can do organic acid testing. We can measure all these different organic acids. We can look at a carnitine to acyl carnitine ratio, which tells us about fatty acid transport into our mitochondria. We can just measure my beloved CoQ10, which is a really valid option. And then we can measure our B vitamins like B1, B2, B5. These are all cofactors in mitochondrial energy production. So there's a lot of testing at our disposal. It just depends how deep into the rabbit hole do we want to go.
Yeah. I think you shared so many that are so accessible that someone might have already had done by their PCP, that they can just start looking at those a little bit more closely and feeling empowered with starting there. And then, yeah, maybe if they need more support, working with a functional medicine doctor who can run the organic acid tests and do all of those and really guide them a little bit more closely with those, I think is a great approach.
Yeah, I love to say that all the time. If you had a wellness exam last year, you probably have a glucose and hopefully, fingers crossed, an insulin, but at least a glucose and probably a lipid panel. So
Mhm.
let's start plugging those numbers into some calculators and you can find out a lot from things you already have.
Yeah, absolutely. Yeah. And on that note, any tips, takeaways that you really want to share with people before we wrap up?
My biggest call to action is start before you're ready. Start as early as you can. When I used to be in primary care and I would get women in their early 20s in for their wellness exam, do their PAP, I would always ask them, what's your fertility future like? Even if you're not ready now, will you be? Do you want children? Just so that we could start talking. It doesn't have to be anything wild. Go to bed at 11,
Mhm.
drink water, avoid alcohol as much as you can. Just these little lifestyle factors that really have a cumulative effect. But even if you're in your 30s now, just start now. You don't have to be ready to get pregnant tomorrow to start implementing all of these things because, like we've talked about, everything that we're doing to support longevity in our fertility is ultimately reducing our risk for chronic disease like diabetes, osteoporosis, cancer, cognitive decline. So when you are ready and you do have that family, you'll have the longevity to enjoy them and spend time in a health span that allows you to do the things that you love. So just start now.
I love that. I love that so much, especially nowadays when, egg freezing is a hot topic. Women are wanting to work for longer periods of time. They're not finding a partner until later. They're wanting to have that time to have babies later. And a lot of people, women are worried about it. But again, like you laid out, they can feel empowered with supporting their health now to extend that reproductive longevity, that reproductive span of time that they have, rather than just feeling scared and helpless about it.
Yeah, and how often do we hear, if I only would have known, if I only
Mhm.
would have known, I would have done something different. That's why we're talking about it now, so that we do know and we can do something different.
Yeah, I love that. I hope all these listeners just go out in the world and they're just going to have amazing reproductive health now. I love it. I love that we can have this conversation and just share this information so it is so more accessible so women can do something about it. Because I really think there's so many women out there who want to do something and they just don't know exactly where to start or what to do.
Yeah. Sending healthy mitochondrial thoughts to all.
And that, thank you so much, Kalea, for being with me today. Again, you shared so much useful information. I think people are really going to love this. So thanks so much for your time here.
Thanks for having me.